Welcome to our webinar, Medicare Made Simple for Patients. Thank you for joining us. My name is Lee Clark. I'm the Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the program today. Due to the high volume of teleconferences on the internet, it is possible you may lose your connection during the program. If you lose connection, please use the call-in number in your reminder email to call in and hear the audio portion of the program. This webinar will be recorded and available on our website within 2 to 3 business days. Immediately following the presentation, there will be a question and answer session. Please feel free to submit your questions at any time during the presentation. To submit a question, please type the question in the Q&A text box window in the lower part of your screen. When you have finished typing, just hit enter. We will do our best to get to everyone's questions today. When asking questions, I do ask that you help me with managing the questions in 2 ways. Please submit your entire question all at the same time. Second, please do not share private health information in your question. Our speaker cannot answer any specific questions related to your personal health care. Our specialist today is Bonnie Dobbs, who is a writer and speaker and the founder of Medicare and Other Red Tape, an Atlanta brokerage specializing in Medicare and Medicaid coverage with agents in several states. Bonnie is very passionate about helping Medicare eligible individuals make the right choice with the right plan and help them navigate the most difficult decisions with their retirement. Thank you so much, Bonnie, for joining us today. We're delighted that you're here. And Tricia, you can unshare and Bonnie can share her screen.
Very good. Thank you, Lee. I appreciate you having me on today. I'm the founder of Medicare and Other Red Tape, and I have been honored to be the expert panelist for the Atlanta Journal, Aging in Atlanta. And currently, I was chosen as one of 20 experts across the U.S. to write a book for the National Aging in Place Council, and our book's going to be released on Amazon September 29th. So if you guys are interested in that, you can get in touch with me afterwards. Okay, so now I can't get my, here we go. Okay, so I'm going to make this, or whenever I was creating this, I wanted to make sure that I made it simple, because oftentimes people become Medicare eligible, much earlier in life than what they anticipated, or they'll have a caregiver to help them. And so, if you're a caregiver, you're just going about your life, then one day your loved one needs you. So I'm breaking this down in simplest of terms for you. What I am going to do is have a question, and then I'm going to answer it, and I will expand on some of these different slides. But one of the questions that people most often ask me is, what is the difference between Social Security, Medicare, and Medicaid? Well, Social Security is money. You just work, you pay the government, and then whenever you retire or if you become disabled at some point, depending on how much you paid in, will depend on how much money that you get monthly. Medicare is insurance. Medicaid is a program for low income. So, what is original Medicare, and when do I enroll if I'm turning 65? Well, there's a 7-month period. It's the 3 months before your 65th birthday, the month of your birthday, and 3 months after your birthday. When do you enroll if you're retiring after 65? The answer to that is 63 days. So you can't go more than 2 months once you've retired without a drug plan, or you're going to get a lifelong penalty. If you're under 65 and own disability, then you automatically qualify for Medicare 24 months after that. So in the 25th month, you are eligible to get on Medicare. Now, one of the things that's new for 2023 is they're going to have a new general enrollment period. In the past, if you fail to enroll on time, then the following January, you had between January the 1st and March the 31st to enroll, and then your plan would not begin until July the 1st. Well, thank goodness they changed that. So, oops, if you made a mistake, didn't enroll on time, starting in 2023, if you enroll in January, your plan will begin in February, not July. If you enroll in February, it will begin in March. And if you enroll in March, it will begin in April. Now, if you miss that time frame, you'll have to wait till annual enrollment again. A couple of other enrollment periods is what we know in the business is IEP, meaning your initial enrollment period. At that time, you can get on any plan that's available to you, or special enrollment periods. This is if you're working past 65, and you're retiring, or maybe you're moving. There's several different special enrollment periods that are available. So annual enrollment every year is from October the 15th, excuse me, until December the 7th. Now, during that time, if you're on an Advantage plan or a Part D, you can change to another Advantage plan, you can change to another drug plan, you can drop your Part D and go to an Advantage plan. So this is the time of year whenever you can review your options and see if the plan that you're currently on best serves your needs. Open enrollment is January the 1st to March the 31st. Now, open enrollment is for Advantage plan enrollees only. So if you enrolled in an Advantage plan during annual enrollment and you take it for a test drive, realize maybe I didn't make the right choice, then you can change to a different Advantage plan, or you can drop the Advantage plan and enroll in Part D. Now, if you're going to drop your Advantage plan and enroll in Part D, before you do that, you want to make sure that you qualify to go on a Medicare supplement plan. Because once you've passed your grace period on a supplement plan, you will have to go through medical underwriting. So that's with Medicare supplement plans only, okay? The other thing that's important for you to know is you can change a Medicare supplement plan any month that you medically qualify. So with Medicare Advantage and Part D's, there are specific times, but with a Medicare supplement plan, you can change plans any month that you medically qualify. Do I have to enroll, or is it automatic? Well, it is automatic if you have started your Social Security. Otherwise, you must enroll. Now, to enroll in your Part B, you can either go to ss.gov/benefits/Medicare. I can send that out to you should you need it. Or you can call Social Security. Let me give you a little tidbit of advice here. If you're going to call Social Security, don't call the general 800 nationwide number. Do a Google search for the town nearest you. And for me, I would just say Social Security Office, Atlanta, Georgia, and call a neighborhood Social Security office, okay? Because if you call the 800 number for the national, you're going to be on hold for darn ever, okay? So do that Google search and call in your neighborhood. And then what does Social Security have to do with Medicare? Well, if you've started your Social Security, your Part B will be deducted monthly from that. If you're delaying Social Security, then they'll send you an invoice in the mail and you have to pay it quarterly. So if you've started your Social Security, they will deduct it monthly. If you're delaying Social Security, they'll send you an invoice in the mail and you will have to pay it quarterly. Now, once you receive that bill, you can go to Medicare.gov and register your account, and you can go right online and pay for it, or you can set up automatic drafts. So that's one thing you don't have to worry about, okay? Or they also allow you to put it on your credit card. Well, some people want to get those credit card points, so they go in every month and pay it on their credit card. So depending on if you've started your Social Security or you're delaying it, those are the two ways that you pay your Part B. How do I qualify for Part A and Part B? Well, the way you get Part A is it is deducted from your FICA taxes, known as Medicare taxes, during your working years. Now, you must work and pay into this for at least 10 years. Once you have fully funded your Part A. So if anybody ever says Part A is free, absolutely no, it's not. You paid for it for a very long time. It's just once you have paid into it for 10 years, you no longer have a monthly premium, okay? So you paid it up. Part B has a monthly premium, and it starts when you become Medicare eligible. So let's talk about the different parts of Medicare and what they cover. If you're on Medicare and you're looking at your Medicare card, it has Part A and Part B. And on Part A, beside Part A, it says hospital. Well, it covers you when you're in the hospital. It also covers skilled nursing, and it covers hospice. So one easy way to remember what Part A covers, just think, it covers you when you're sick and in the bed. So in the hospital, in skilled nursing, and hospice. Part B covers a whole lot of territory. It covers in and outpatient treatment, like your doctor visits, your doctor services, medical supplies. So what does that mean? Say you go to your doctor, and do you need for your doctor to put on a Band-Aid? Do you need for him to stitch you up? Do you need for him to do brain surgery? whatever your doctor needs to do, whatever service he needs to provide for you, it's going to pay him to do that. And then it's going to pay for the medical supplies like the stitches or the scalpel or whatever he may need to complete that. It pays for blood. Part B pays for diagnostic tests. That could range anywhere from MRI, CAT scan, x-rays, biopsies. It's going to cover all your diagnostic tests, durable medical equipment. That's things like wheelchairs, canes, oxygen falls under durable medical equipment, rollators, CPAPs, therapy. So that's physical therapy, occupational therapy, speech therapy, and Part B drugs. Now, this is probably most interesting to you all. Part B drugs are drugs that have to be administered through an injection or an infusion by medical staff. So your doctor or nurse practitioner would be administering the Part B drugs. So Part A says medical, but you can see it covers several other things. And Part B covers a lot of territory. I hope this slide helps you understand original Medicare and what it covers. So what is Part C? We've talked about Part A and Part B. Well, Part C is easy. It's just another name for a Medicare Advantage plan. Medicare Advantage plans are good anywhere when there is an emergency. Otherwise, they are service area specific. Part D is really the only part of Medicare that I think kind of makes sense, or you have some way of linking the two. So Part B is just a Medicare prescription drug plan. Now, these plans are available as standalone if you wanted to get a Medicare supplement plan, because supplements do not have the drug plan built right in, or they are built in to Advantage plans. Now, you can get an Advantage plan without the drug plan built in, but most people want the drug plan built in. Part D always has a network of pharmacies. This is important for you to remember, because if you're not using the network of the plan that you have chosen, then you're going to pay, or you could pay more for your medications. Now, there's two ways to get coverage to offset the cost of original Medicare. So we got Part A and Part B, and they pay their part, but that leaves you owing the Part A deductible, the Part B deductible, and that other 20%. So let's talk about the two ways to get insurance coverage. One way is with a Medicare Advantage plan. The other way is with a Medicare supplement plan, also known as Medigap. And like I said before, Medicare supplement plans do not have drug plan built in, so you must purchase a standalone drug plan, or if you don't, you will get a penalty. Let's talk about some of the characteristics of a Medicare supplement plan, also known as a Medigap plan. With a Medicare supplement plan, they do not have any networks, which means you can go to any provider in the nation, not just in your neighborhood, who accepts Medicare. So if you wanted to go to another state or another hospital for your treatment, pack your bags and you can go. Now, the plan's not going to pay for your travel expenses, but it will pay for your medical care at that provider wherever you are in the United States. And some of them offer out of the country. There's no referral. I mean, after all, if you have a rash on your arm, you know you need to go to a dermatologist, right? So that's good that you don't have to go to your primary care to get a referral. You can just go to the doctor, call and make an appointment. Now, a supplement plan does have a monthly premium. And I said may have a deductible. The reason why I said that is with Medicare, it seems like there's always some type of extenuating circumstance, okay? If you have a Plan F, which means that you became Medicare eligible and you were on a plan prior to January 1, 2020, you could have chosen a Plan F. And with a Plan F, there's no deductible for Part A or Part B. If you became eligible for Medicare after January the 1st of 2020, you will have a deductible. Your Part B is $233, and that's for 2022. So a Medicare supplement plan is known as Medigap plan because it does help fill in those gaps left open by original Medicare. What are some characteristics of a Medicare Advantage plan? Remember, I was telling you earlier, a Medicare Advantage plan is also known as Part C. First of all, let me reiterate, a Medicare Advantage plan is not a Medicare supplement plan, and they're often referred to as replacement plans because they have all of the benefits of Part A and Part B, original Medicare, but they usually have additional benefits like dental, vision, hearing, over the counter. They are service area specific, and they do have a network of providers that you must go to. Medicare Advantage plans have copays, coinsurance, and we call it MOOP in the industry, but it's known as maximum out of pocket, and they may or may not have a monthly premium. Medicare Advantage plans are the ones that you see most often advertised on TV, where they say you may be missing benefits like getting the Part B paid back. Those plans are specifically for low income. However, most Advantage plans do have the additional benefits like the dental, vision, and hearing in them. What are some types of Advantage plans? They come in things like HMO, PPO, PFFS, HMO, POS. I'm going to go over the two most common of those. The HMO, if you're on an HMO, you must stay in their network, or if you go out of the network, you have to pay the entire cost. Rarely, but sometimes there will be an exception where your doctor will refer you to somebody out of the network and the insurance company will approve it. But if you're on an HMO, the rule of thumb is you must use in-network providers, whether it's a doctor or a hospital or a physical therapist, okay, whoever. All the providers must be in the network. A PPO gives you some flexibility and some options, because with a PPO, as long as you stay in the network, you're going to pay less for your copays or your coinsurance, but they do give you the option or the flexibility to go out of the network. Now, should you go out of the network, most all plans charge an additional or it's a higher copay or a higher coinsurance. Sometimes, and you'll have to make sure whenever you're going over with your agent, some companies, there's only a few of them, will have the same cost whether you're in the network or out of the network. Now, there's specific types of Advantage plans like dual. Dual plans were created for those people who are on both Medicare and Medicaid. Recently, in the past couple of years, they have created plans just for veterans. So if you're a veteran, you can get some additional benefits like dental and vision and maybe some reimbursement for your Part B. So you'll want to contact your broker and see if you have VA and see if you qualify for any of those. And chronic plans differ from state to state. I'll give you an example. In the state of Georgia, if you have diabetes or heart problems, there are chronic plans, and if you switch to one of those Advantage plans, you'll pay less for your drugs. In the state of Florida, they offer heart, diabetes, and also COPD. So depending on which state you live in will depend on which plans are available to you. But these specific plans will always offer you more benefits than just someone who's just on a regular HMO or PPO. Beware. If you retired from the railroad, from a union, if you're a federal employee, you will incur copays and coinsurance if you enroll in an individual plan and risk not being able to return to your plan. Also, if you leave an employer plan or a retiree plan and enroll in an individual plan, you can never return. I mean, it's like once you're out, they're not going to let you back in the nest. You're out for good. Okay. So if you are on railroad, union, federal employee, or an employer plan, make sure that you talk to a very knowledgeable individual broker that is educated on these plans and on exactly what plans are available to you, because it would break my heart if you gave up your good benefits from your previous employer and went on an individual plan and now cannot get back on the plan that you just came off of. What is LIS? It's also known as low income subsidy, or you guys may know it as extra help. If you have a Medicare and You book, you'll see extra help in there. And extra help, it's a program that helps low income lower the cost of their drugs. Now, depending on what level your income is, will depend on how much you pay for your medications. The lowest, well, it ranges anywhere from a percentage, with the lowest being like 0 copay for tier 1s and maybe $9.85 for the most expensive. But once again, This is an income-based benefit. And IRMA is just the opposite end of the spectrum. So IRMA stands for Income-Related Monthly Adjustment Amount. There's always a 2-year look back, and what they're looking at is your MAGI on your taxes. So for this year, it would be for 2022, they would be looking at your 2020 taxes. So for this year, to find out if you're subject to IRMA, if you are single and you make up to $91,000, or if you're married, filing joint and make up to $182,000, you'll just pay $170.10 for your Part B, as in baby. Should you exceed those thresholds, then there's an escalating chart that goes up to $750,000 and over. So I've enrolled some people and they're paying like $500 for their Part B, and also IRMA affects your Part D. So how do I avoid penalties? It's real simple. Enroll on time and then never disenroll. Because if you ever go more than 63 days without coverage, you're going to get a penalty. And in the Medicare and U book, it says penalties are for as long as you have Medicare. Well, how long are you going to have Medicare? As long as you live, right? So you want to make sure once you're enrolled or once you become eligible, enroll and never disenroll. What happens if I'm on an Advantage plan and my provider goes out of network? So let's talk about this. No provider, whether it's a hospital or a doctor, are required to accept Medicare or Medicaid or whatever insurance company that you may be on. They all decide who they're going to be in network with. So your provider, their contract may not necessarily be the same time span as your plan. So all plans begin January 1st and end December 31st. Well, what if your doctor, if you're on an Advantage plan and your doctor in May decides he's not going to renegotiate and accept the company that you're with? Once again, remember whenever I was talking about HMOs and PPOs, if you're on an HMO and you continue to go to that doctor, you'll have to pay the full cost. If you're on a PPO, you'll be able to go, but you're going to have to pay the out-of-network cost. So let's talk about some changes for 2023. Starting October the 1st, we're going to have agents are going to have to record all calls between the agents and the clients, including the enrollment. And these recordings must stay stored for 10 years. This has really raised the ire of many reputable agents, and clients are not aware of this right now. I'm sure there are clients who don't want their private information recorded, much less stored somewhere in a cloud for 10 years. Now, of course, this is in direct response to all those crazy TV commercials that you see about Medicare. So it's like reputable agents are being punished as well as the public, as well as you guys are. So I have actually been on webinars this week myself, learning how we're going to record and store all of these. Whoops, sorry about that. What about prescription drugs? Well, the annual deductible for 2022 is $480. And I just read yesterday where in 2023, and you guys want to write this down because I just found out about it yesterday. The most any prescription drug deductible can be starting in 2023 will be $505. This kind of breaks my heart. I've been doing this for a long time. And when I first started doing it, there was no drug deductible for people on fixed incomes having to pay up to $505. It's pretty disgusting. A couple of weeks ago, there was a bill that was passed to have $2,000 as the maximum out of pocket. But now this is not going to begin until 2024 or maybe 2025. So there is hope down the road, but between now and then, if depending on your medications, your deductible alone could be up to $505. The Part A premium and deductible has not been released for 2023. Neither has the Part B been released. Now, the next few slides that I have, I copied them right from Medicare.gov. I do want to go over some of these with you because I'm going to explain a little bit as we go along. This will probably be this is a great resource for questions because you'll have it without having to go to Medicare.gov to find this information. But the way Part A works is it may cover bone marrow stem cell transplant if you meet eligibility requirements. They may cover bone marrow transplant and treatment for the following, which is some of the diseases for some of you or some of your loved ones that's on this call. Just know with MDS, there has to be a Medicare approved clinical study to go along with your bone marrow transplant in order for Medicare to cover that cost. Also, you'll have medications afterwards that your doctor may require you to take for antibacterial, antifungal, antiviral to combat potential infections. Since Part A and B don't cover medications, in most instances, you'll need to get Part D prescription drug coverage to help cover those costs. Remember, I said earlier, Part B medications are medications, they're injections or infusions that's given by a doctor. But any pill, eye drops, ointments, those type things, those follow under Part D drugs. Additionally, you'll want to think about your out-of-pocket cost associated with bone marrow transplants, should you need them, because there's copays, coinsurance, deductibles, and it says Medicare's coinsurance is 20%. That's the reason it is so important to talk to a Medicare broker who can get you into a plan to help offset those costs. This means that if you only have original Medicare and don't have a secondary to pick it up, you have to pay for it yourself. The last bullet point, if you have original Medicare, you can consider purchasing a Medigap policy to help cover those costs. You can also consider enrolling in a Medicare Advantage plan because those do have a maximum out-of-pocket limit, whereas original Medicare, just Part A and Part B, does not. Now, this is important to know also. You must get an organ transplant or bone marrow transplant in a Medicare approved facility in order for Medicare to pay, or in order for any of the insurance companies to pay. Medicare may cover transplant surgery as a hospital inpatient service under Part A. Medicare covers the immunosuppressive drugs if the transplant was covered by Medicare, or your employer or union group health coverage plan was required to pay before Medicare paid. But remember, you must have Part A at the time of the covered transplant, and you must have Part B at the time you get the medications. So you have to have original Medicare before this starts. And once again, this is just reiterating, you'll pay 20% of Medicare approved amount for drugs, and the Part B deductible will apply. Now, I was talking about the Part B deductible is these plans can charge up to $505. Not all of them do. Medicare drug coverage covers drugs if Part B doesn't cover them. If you're thinking about joining a Medicare Advantage plan and you are on a transplant waiting list, here's some of the things that you need to check with first with that plan. You'll want to make sure that your doctors accept the plans. Make sure that other healthcare providers like the hospital or specialist or anesthesiologist accept your plan. Not only accept it, but it's important that they're in the plan's network. Remember, if you're on a PPO and you stay in the network, you're going to pay less. If you're on an HMO, you are required to go in the network or pay the whole bill. So you're going to want to check what the plan's rules for prior authorization. To find out how much your test, item, or service will cost, you're going to have to get that information from your doctor. And these are some of the things that will depend, like what other insurance may you have? I mean, you know, do you have like an Aflac type policy that would pay if you got diagnosed with cancer or hospital visits? How much does your doctor charge? Does your doctor accept assignment? What that means is, does your doctor accept Medicare assignment? So if your doctor accepts Medicare, they should accept assignment. Always ask. And then the type of facility. Are you going to be in the hospital, an outpatient, or in an ambulatory center? I know my son got shoulder surgery at an ambulatory center, so they're doing more with those, and it usually costs a little bit less than being at the hospital. And also, this is something people really don't think about, is where you get your test or buy your item or get your service. So say you're going to your doctor and your doctor said, I need for you to go get blood panel and and just gives you the name of either an imaging company or somebody who does blood draws. And you look at your insurance and that they are not in your network. Immediately call your doctor back and find out who or tell your doctor that they're not in your not in the network, and give them some options of who, or ask them who else that they would refer you to go to. So you want to stay in network always as much as possible. One thing to remember, if you're on a Medicare supplement plan, none of this really matters so much, because with a supplement plan, it's going to pay what original Medicare doesn't, except for your deductible. You are going to have a monthly premium, but you can, you don't have to think about this laundry list of things. What does it cost to get help with your enrollment or have your current plan reviewed by our company? Nothing. There's never a charge for our services. My team would love to help you. Our services are free. Please know we are not affiliated with the U.S. government, federal or state Medicare programs. At this time, I would like to open it up to Q&A. And I think that Lee, do you have any questions?
Absolutely. Thank you so much, Bonnie, for that very informative presentation. And I'm not sure if you can answer this, and or if you can't, maybe could provide some insight where maybe somebody could get the answer. So this question comes from an American citizen who also is a Canadian citizen. They have dual citizenship. They've lived and worked only in Canada their whole life, but recently bought a home in Phoenix to use about 6 months a year. By any chance, do you know if I might be eligible for some type of American health care?
Yes, you can buy both Part A and Part B. Part A is around $455 a month, and Part B is $170.10 a month. But you can purchase it. You could, like I was saying earlier, Google your local Medicare office and tell them your situation, and you're wanting to live in the US for half the year, and find out the cost specifically for you. If you never worked in the US, those are the charges. If you did work at least 30 hours, no, how does that work? 30 quarters. I'm sorry, I started to say 30 hours. If you have worked at least 30 quarters, then it's under $300 a month. So you do get a little price break there, but those are the cost, and it's call Medicare's local office to find out exactly what those costs are and how to sign up if you are interested in that.
Thank you so much. What is the appeal process for anyone on Medicare if they've been denied approval for a procedure, or what is the approval process like?
You call the insurance company that you call your insurance company and just tell them you want to appeal whatever, and they will provide you with all of the information that you need to handle your appeal. And they're usually really helpful with doing this, because they understand. The thing is, if Medicare doesn't approve something, or remember, if Medicare doesn't approve something, the insurance company's not going to approve it. So if you are appealing something, you want to go through the insurance company.
And is this something an individual can do on their own, or do they need to have an attorney provide assistance?
No, you can do it on your own. I mean, I know somebody, they appealed something 9 times. This lady was extremely persistent until she got what she wanted. Her father, I think, needed to go into nursing home after a hospital stay, and the insurance company, I'm not sure if they weren't getting the correct information they needed, but she was so persistent. So don't give up. You just keep going back through the insurance company, just to do the process again.
Thank you. And for patients with aplastic anemia, MDS, or PNH, they're rare diagnosis, and sometimes there's not always specialists who are in their area. Is there a way to get out of area approvals if somebody were to have to go see someone that, say, was not within their network because there isn't anyone in the area that specializes? Is there a way to get approval to see someone who may not be within your network?
I would go to your doctor, your primary care doctor, and ask your doctor who he would refer, or maybe do the research yourself, find out the provider that you want to go to, and then go to your primary care doctor, discuss it with him, and then he can put it through the insurance company. And you can also call the insurance company also to make sure you get approval. Once you get approval, don't just be satisfied with talking to somebody on the phone. Get it in writing. Either get it through the mail or through an email, but make sure you get that information in writing that you can go to, and it'll be somebody specific. It won't say like, you can go to somebody in Washington, D.C. Okay, it will be a specific doctor. So you'll want to do your legwork first before you call your primary care doctor, see if he can help you out getting that approved.
Thank you so much, Bonnie. Our next question comes from a veteran who is also retired and on an Advantage plan. They'd like to know, does it matter if you serve during a time of conflict or a peacetime veteran to receive the VA benefits that you mentioned?
No, it doesn't matter. What I was talking about is veterans, they created some special Medicare Advantage plans just a few years back geared toward veterans. Those plans specifically do not have the drug plan built right into them, because you can get your medications free or very low cost through the VA. I think what you may be talking about is, oh gosh, I can't remember what it's called, but depending on, and I may be out of turn with this, but I think depending on how long you were in the military, you had to have served during wartime. That does not mean you were on the front line. It doesn't matter where you were, but you had to serve at least one day you had to have one day of active duty during wartime, and then you and your spouse qualify for some help with nursing home. And it's quite a bit of money too. I think it's like $2,000 or maybe a little bit more. So you can call the VA, or there are some elder care attorneys that give you guidance. If you're going to use an elder care attorney, Mr. VA, okay, please listen up because this is important. If you're going to use an elder care attorney, they should not ever charge you for this. They should just provide the information for you, so you'll know where to go, how to get enrolled, and that type thing. Okay, so they're not going to do it for you, but they can provide you with a kind of a step-by-step approach, so you can go do it for yourself. But absolutely, thank you so much, veterans, for your service, and you were there, and because of your service, you have earned this benefit. So it's really important, I think, for you to take advantage of it.
Thank you so much, Bonnie. Our next question is, how do you compare supplement plans? Where do you find out about them? They'd like to know, it says different companies, not different types of plans on Medicare.gov.
You can go to Medicare.gov to find out what plans are available, what companies are available. You'll want to go to a broker direct, because they're the ones that deal with clients in these plans every day, and they're going to have more like behind the scenes kind of information than what you can get on a website. So just call your local broker, or you can give us a call. There's no fee for our charges. Remember, if you're going to be changing from one supplement plan to another and you're past your grace period, you will have to medically qualify.
And Bonnie, how does someone determine that the broker that they're contacting is a reputable broker? Is there some type of oversight that's done? How does someone make sure that they're, communicating with someone who, really is qualified to be able to assist them?
Sure. What you'll want to do is you'll want to find somebody who is contracted with the companies in your service area. Okay. So anybody can go to medicare.gov and, and look at all the plans that are available. But whenever somebody like me, whenever you call me, I probably can recite most of these plans to you without even looking them up, because we do this every day, all day long. So the main thing with the broker is you want to make sure that they offer the plans that's available in your area. If they don't, then you need to call somebody else, because only by being able to do a comparative analysis with all the plans in your area will you know which one is the best based on your needs. Make sense?
Yes, thank you so much. Our next question is coming from a spouse. His wife had a transplant, a stem cell transplant for MDS in 2014. They'd like to know, do the new rules for 2023 affect her current care?
I don't know, because they have not released anything for 2023 yet. That will, all of the plans with the benefits will be released on October the 1st. However, and I just received one myself. Every year, this is for everybody that's on the call, okay? Every year during the month of September, we receive this thing called annual notice of coverage, okay? In the annual notice of coverage, what it does is it goes down line item by line item, comparing your plan with this current year with next year's plan. And it starts with the monthly premium, the deductible, and this is a drug plan. So it was really important to me to find out how much my medications are going to cost me next year. So on my specific plan, my plan only went up like less than $5. My meds went up $1 a month, I think, for a 30-day supply. So I don't have to do anything. I can just let my plan roll over. Now, should you get this annual notice of change and your plan was costing you, and I'm talking about drug plans right now only, guys, okay? And your plan was costing you $15 a month, and now it's going up to $45 next year, then at that point, you want to have someone research plans that are available to you based on your service area and based on your medications. So Advantage plans and drug plans, every year you're going to get this annual notice of change, and you want to compare what your plan is this year with what's coming down the pike for next year. Because at that point, you can decide if you do need to have your plan reviewed, or if you're good and you can just stay where you are. Because if you do nothing, your plan will just roll over, okay? But should things have changed, your medications have changed, maybe your doctors are no longer in the network, or you're going to new doctors, okay, in that case, you may want to have your plan reviewed during annual enrollment.
Thank you. Our next question is, I currently live in one state, but I'm moving to another state. Do I need to do anything regarding my Medicare?
Absolutely. As a matter of fact, I did a podcast that's on the internet on YouTube, or I did a YouTube video rather, and it's all just about moving. Number one, when you move, you're moving out of your service area. Okay. So you're going to have to get a new plan in your new service area. So if you're on an Advantage plan or a drug plan, you have the month before, the month of, and up to 2 months after. Remember, you can't go past 63 days or you'll get yourself a penalty to change plans. You can also call, once you have moved, you'll want to call Social Security, because Social Security always needs to know where you live. They need your current address. You don't want them sending your information to your old address because you don't know who lives there, right? So you'll change plan whenever you move. You need to have your plan reviewed and get a plan in your new service area. Make sure you do it in a timely fashion. And once again, this is where a good broker can be very helpful, because you can, you may like the plan that you're on and want something similar, or I don't know, maybe if you're on an Advantage plan, maybe you need more dental this year, or maybe you would like to have more over-the-counter benefits. So, or maybe the doctor has prescribed physical therapy. So you need to get on a plan where you can bring those therapy appointments down some. So contact the brokers that can help research all the plans in your new area.
Thank you so much, Bonnie, for sharing your time and your expertise with all of us today. It's so much appreciated. If you have any additional questions, you're welcome to send it to us at any time in 3 ways. Send an email to help@aamds.org. Call our helpline 800-747-2820, or you can submit your question to our Facebook page. This webinar will be available to watch on demand within several days and will be posted on our website. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today and making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 39 years. This concludes our session. Thank you again, Bonnie.
Thank you so much, Lee, for having me on. I appreciate that. I hope everybody learned something today and they can carry it with them for years to come.
Take care, Bonnie. Thank you again.
Bye now.